is currently.
Good evening, everyone. Thank you for joining our live Fighting for Affordable Care telephone town hall. The purpose of this event is to discuss your concerns about Republicans' refusal to extend the Affordable Care Act enhanced premium tax credits and to reopen the government, and how Congressman Jim Costa is fighting to protect affordable care for the Valley. This is an interactive forum, and we would love to hear from you. If you have a question, you can press *3. That's *3 on your keypad at any time to get in the queue to ask a question. We will do our best to answer as many questions as possible this evening. Without further ado, Congressman Jim Costa.
Well, Grant, thank you for that introduction, and good evening, friends. This is your Congressman Jim Costa, and thank you. Thank you very much for giving me the opportunity to serve you in our nation's capital, and thank you for being a part of this evening's telephone town hall. I think these are good opportunities for constituents in the 21st District in Fresno and Tulare counties to participate, to ask questions, and to make suggestions. Tonight, I want to talk about something that's very real and very personal to all of our families in the San Joaquin Valley, and that's the cost of your health care. And I'm reminded of my mom, who once told me, Jim, if you don't have health, you don't have anything. And you can't have good health without good health care. For the past week, sadly, renewal notices have been going out from Cover California. And what people are seeing, I believe, is shocking. Premiums are doubling, and in some cases even tripling for 2026. And you might ask why? Well, because those who are covered under the Affordable Care Act, the premium tax credits that have kept the health coverage affordable since 2021 are due to expire. And we've been pleading with our Republican friends, our colleagues, that we must address this issue because notices are going out, now? And people are shocked. And people also need to know, what is Congress going to do about it? In my district alone, the 21st District, more than 22,000 people rely on these tax credits. Let me give you some examples. Without these tax credits, a 60-year-old couple in Fresno will pay $18,000 more next year for the same plan. That's outrageous. A family of 4 in Tulare County could pay over $2,500 to $3,000 more for the next year. These just aren't numbers on a page. What, for me, is these are working families. The majority of working families here in the Valley and throughout our country live paycheck to paycheck. And if we don't address this issue, they will be priced out of the health care if our Republican colleagues refuse to sit down and to reach very important agreements on how we go forward to provide that tax credit under the Affordable Care Act. Now, mind you, this comes on top of the damage I believe that has already been done when the majority, of course, as you know, the Republicans control the House and the Senate and the White House, so they're in charge, and they should be acting to ensure that we don't shut down the government. But they passed back earlier this year the big, I never called it beautiful, it seemed very threatening and ugly to me, a law that slashed Medicaid funding and threatens to strip the coverage over 65,000 people in my congressional district. You add that to the 22,000 people who get their health insurance through the Affordable Care Act with the tax credits, and in my congressional district, that's over almost 100,000 people. These are our neighbors, our friends, family workers, co-workers, caught up in the middle of Washington's inability to reach the kind of compromises you expect of us, and instead playing political games. I just returned from Washington last night, where I have been working to protect your health care, while my colleagues on the other side of the aisle have walked away from their responsibilities and refused to show up for work. My office is fully operational, including yours truly, and they aren't receiving a paycheck, and neither am I. We have essential roles to play, and therefore we must be at work. And I've gone back to Washington throughout the last 4 weeks to be there to meet with my Republican friends so that we can bring the House back into session. Speaker Johnson has recessed the House, and therefore we don't have Republicans and Democrats in Washington able to sit down and work out the compromise that is necessary. Let's be clear what this is all about, this shutdown of government, which is irresponsible. But it's an attack on our health care. It is the health care tax hike on working families, small business owners, and seniors in our community that will occur if we do not work this out. And therefore, I urge, I implore, I beg of my Republican colleagues to come back to Washington to work on bipartisan solutions regarding America's safety net, our health care, and to reopen government. It's irresponsible to shut it down and to leave Valley families paying the price. It hurts America, it hurts our economy, and it hurts Americans. And therefore, we must do everything we can to reopen government. That's why I'm fighting to extend these tax credits, to protect Medicaid, and to make sure every family affected in Fresno and Tulare, Kings, and Kern counties have access to affordable, quality health care. That's what my mom said. Jim, if you don't have health, you don't have anything. So tonight, we want to hear your questions, your stories, because at the end of the day, this is about America's safety net to provide health care to our country. It's about you and your family, your ability to see a doctor when you need to, or to have your prescription filled, to keep your children and your parents healthy. Now I want to introduce Kelly Green, who is with Cover California, and of course my talented staff who are part of tonight's town hall. Kelly is participating with us this evening, serves as the Director for External Affairs for Cover California. She's a partner in this effort, in essence, where she leads the agency's legislative work policy on health insurance and health care issues. It is in this role that she serves as the first point of contact, not only for the state legislature, but key stakeholders in the healthcare community, advising Cover California's executive director and their board of directors on pending legislation and providing testimony. Kelly Green brings an extensive amount of experience in the state health policy and government affairs, and before that worked in the state legislature, worked with the California Nurses Association and the California Department of Health Care Services. She's a graduate of the University of California from Davis. Yay, Davis. And Kelly, we're very thankful that you could participate, and let me hand off to you for some opening comments that you, I know, would like to make.
Thank you very much, Congressman Costa. Thank you so much for that kind introduction. And I would first like to begin by thanking you for hosting this conversation and for being a continued champion for your constituents for healthcare, not only for your constituents, but for all of those who rely on Covered California. I will provide a little bit of brief background, and I know that we are looking forward to having a very rich discussion, so I will try to stay succinct. But I do want to start with just some basic background, which is that Covered California is California's marketplace under the Affordable Care Act. We serve nearly 2 million Californians through our marketplace. These are hardworking Californians who do not have coverage from any other source. So these are working Californians who do not have coverage from an employer or through a spouse. They earn too much income to qualify for Medi-Cal. They're not yet old enough to qualify for Medicare, so they turn to the marketplace to be able to enroll in comprehensive, quality, and affordable coverage. Since Covered California opened its doors, About 1 in 6 Californians has enrolled through a plan at Covered California at some point. So chances are you are related to a person, or you know a person, or you are receiving or have received a service from a person who gets or has gotten their coverage from Covered California. Covered California offers tax credits, as the Congressman mentioned, that bring the cost of coverage within reach. It makes coverage affordable for Californians. The tax credits are on a sliding scale. The less you make, the more you get. And since 2021, the tax credits have been enhanced, making coverage more affordable than it had ever been before. So affordable that we have seen record enrollment in California and across the country since the enhanced premium tax credits were put in place. And Congressman, as you've outlined, these tax credits are, the enhanced tax credits are at risk of expiring at the end of the year unless there is action taken to extend them. If they expire, we expect millions of people across the country and so many here in California to be at risk of not being able to afford their coverage in 2026. Here in California, on average, if enhanced premium tax credits expire, we expect to see premiums to at least double. On average, that means the average Californian who's enrolled with us is going to pay over $125 more per month. And depending on your circumstance, how many people you have in your household, your age, where you live, those numbers could be much higher. We also expect about 400,000 people at risk of losing their coverage simply because they won't be able to afford it any longer. So timing is really critical here. There are, nearly 2 million Californians across the state rely on Covered California and have affordability of their health care at stake. So we are very pleased to be here tonight to help answer questions, provide information, and really work to continue to be a resource to make sure that we are a voice for the 2 million Californians who are enrolled in Covered California, and do what we can to help this dialogue and hopefully advance an extension of these enhanced premium tax credits. Thanks again for having me here.
Thank you, Kelly, and thank you, Congressman. Now, this is an interactive forum, and we'd love to hear your questions. Now, we will be beginning the question and answer portion. To help to keep the conversation focused and informative for everyone, we kindly ask that questions stay on topic of healthcare and the government shutdown. If you have a question, you can press *3, that's *3, on your keypad at any time to get in the queue to ask a question. A member of our staff will collect your questions, and we will answer as many as we can during this live event. If you would like to seek immediate casework assistance, you can speak to one of our experienced caseworkers right now. Please press *0, that's *0, to be immediately transferred to speak to one of our caseworkers. Again, for immediate casework assistance, please press *0. In addition, if you'd like to be added to Congressman Costa's newsletter as a subscriber, press *6, that's *6, where Team Costa will be able to take down your email and add you to the list. Again, if you have any questions throughout the event, please press *3. Now we're going to bring on our first caller. We have Catherine coming live from Fresno. Catherine, you are live on the air. Please feel free to ask your question for the Congressman.
Hi. My question is, why don't the Democrats just make these tax credits permanent instead of fighting year to year?
Good question, Catherine, and I'm fighting to do that. There are two pieces of legislation. One, my colleague and neighbor, Congressman Adam Gray, has introduced legislation of which I am a co-sponsor to make the enhanced credits permanent, period. And it would, I think, maintain the affordability that we're talking about and stop the political brinksmanship every year. There's also another separate piece of legislation that is bipartisan as well for a one-year extension by Representative Keegan. But I think that the best way to deal with this issue is to enhance the tax credits and make them permanent, and I think that's what we should do. I hope I answered your question.
Thank you, Congressman. And next we have another call from Heather from Kingsburg. Heather, you are live on the air. Please feel free to ask your question to the Congressman, Heather.
Hi, Congressman. For a little background, I am the parent to a medically complex child. He's a teenager. To be fair, we have private insurance, but there are still programs that my son benefits from that are like Medi-Cal, Medicaid funded. We also use Valley Children's a lot. And I know that when a lot of these credits go away because of EMTALA, emergency care can't be refused. How do we protect our local hospitals whenever the funding goes away so that care is available for everybody? It's a really scary time right now to be the parent of a medically complex kiddo, a kiddo who's in special ed. And it just feels like everything is a fight right now.
Well, Heather, I can hear and the passion and the heartfelt way in which you've described the situation with your son. The cuts that I talked about earlier on Medicaid and Medi-Cal go to the heart of what you're talking about. 75% of Valley Children's reimbursement of patients are covered by Medi-Cal. Medi-Cal is the same as Medicaid. We refer to it as Medi-Cal in California. And the cuts that were made with that big, ugly bill are the largest cuts that we've had in Medi-Cal or Medicaid in the history of the programs. And I'm very concerned. We had a workshop with our hospitals back in August after the passage of this legislation with Valley Children's, with Community Medical Center, with CAWIA, with Adventist Healthcare Systems. And it's why I'm continuing to implore the impacts of this. And for other rural parts of America, our rural hospitals are going to be devastated, I think, in terms of their ability to continue to keep their doors open, let alone be able to continue to provide the level of care that you believe and you want your son to have. It's just that simple. That's the bottom line. And so while we're fighting for the Affordable Care Act right now, we've got to address the larger question. And I know that the Valley hospitals here are working very closely with myself and others to try to see where we can fill the gaps that have been created as a result of the cuts in Medicaid and Medi-Cal, not to mention the Affordable Care Act tax credits that we've been speaking of. So when we look at that, it is, I think, something that is going to really hit home here in the next year. We have congressional districts here in the Valley alone, in which it's estimated the 5 of our districts, 1.8 million people will be impacted. And in California, the totality of this, 43% of all the children in California rely on Medicaid, Medi-Cal. 40% of moms giving birth to their newborn babies rely on Medi-Cal. 61% of the people living in nursing homes in California rely on Medi-Cal, and 25% of the Medicare beneficiaries are duly enrolled. And young people between the ages of 19, 22.8% of adults are impacted. And so this is how dramatic and serious this is, and that's why I'm fighting for you, Heather, and for your family. Thank you for the question.
Thank you, Congressman. Our next question comes from Ms. Delgado from Fresno. Ms. Delgado, you are live on the air if you'd like to state your question for the congressman.
Oh, yes, Congressman. My question is, aren't the congressmen and senators and White House employees, including the president, aren't they government employees?
Yes.
Okay, then they should not get their paycheck either. They should not get their paycheck just like the rest of the government employees that are not getting paid.
Well, I agree with your sentiment, and that's why there's been legislation that has been introduced that would do just that. But in the meantime, before October 1, because my staff and because so many people with essential services are not getting paid, I wrote to the House administration that I did not want to receive my paycheck as long as government was shut down. I think that I need to set the example, and that's what I'm trying to do. And I hope that other members of Congress and this administration would try to maintain that example as well when you've got so many people who are living paycheck to paycheck and not receiving payment. It's just not right.
I have to really praise you, Congressman, because that is really, really honorable what you're doing. And also all the money that he's spending knocking down that part of the White House and building a new one and spending all that money when they're cutting down all these people from their insurance, that is horrible.
I couldn't agree with you more, Ms. Delgado. I mean, I think that the White House, as I've told every president over the years when I've met them in that very historical residence for all of America's presidents, that it's the people's house. I say, it's an honor to be in the people's house and to take on that demolition without getting input from the public, without dealing with the historical assets of the East Wing, and to put a 90,000 square foot ballroom that, mind you, the size of the White House is 55,000 square feet. This ballroom, as described by the president, is going to be 90,000 square feet. And then at the same time, trying to get the Department of Justice to provide $230 million to the president. It makes no sense. And I think the optics are very bad. And I'm just saddened that this is taking place.
Thank you so much, Congressman. Our next question comes from Mr. Joe Garcia from Fresno. Joe, you are live on the air. Feel free to ask your question for the congressman.
Hello?
Hello.
Yes, Congressman. My grandparents are immigrants. They're Italian farmers on Kearney Boulevard. My mother is currently 102 years old, residing at the California Armenian home. She just won a proclamation from the city for all her service at the community, from St. Alphonsus to cooking for firemen to working her whole life. And they gave her a city holiday 2 years ago, Representative Tyler. And if people do not think that at these rest homes, the California Armenian home, my mother voted at 101 years old, yes, on Proposition 50.
God bless her.
If people do not know, Congressman, that these people do not know what's going on at the California Armenian home, my mother calls me horrified because she's on subsidies Medi-Cal, and they're so afraid with the corruption. Now, you've got to realize, well, you do. My father in Korea, World War II, my 3 uncles have served. We are a family that have come here as immigrants, have worked at Kearney Boulevard, one of the first 7 Italian ranchers. They are hardworking, but you know what? They're terrified because my mother went to a doctor, and they call it. I don't want to stutter here because I've got to keep my calm, being Italian. They called the head resident doctor to ask what my mother's changed, and she said, "There's always been some corruption in politics, but never to the degree, Congressman, that is now. They're afraid that their subsidies from Medi-Cal is going to be taken away, and they're going to be put on the street. They know what's going on. They know the corruption of this administration. She calls me. She knows what's going on. We're fortunate. My husband, we're going to bring her home. We're blessed to be able, but the folk in the rest homes that aren't able to do, that are subsidized, Congressman, they're scared. They know what's going on, and they are doing everything they can to vote, but when I go to visit and they talk and they watch CNN, they watch Fox, they see what's going on, and they said, this man don't care. He don't care about the children starving. He don't care about us. They even know what happened with polio, the vaccinations. They lived through all of this, Congressman, and they asked me, Joe, what do you think's going to happen to us? I go, and they go, we just have to pray. And I go, yes, we have to pray, because they don't feel they voted for Proposition 50 already. They received their ballots. But, Congressman, they think that corruption that they've never seen before, and all we can do is do what we're doing, Congressman, but they don't think it's enough, because they think this man is so corrupt and all-powerful, and that my mom even said all the Republicans it's a cult, Joe. They think it's a cult. They don't understand what happened. I want to keep this to what they're fearful about what's going to happen with their subsidies, and they have a right. But I am upset because I don't feel at this age they should have to worry about anything. That's their right. They've served in this community. My mother received a proclamation. She has a city holiday, Congressman, right there at our city hall. She shouldn't have to worry. She went to the basements and cooked, and that's it.
Mrs. Joe Garcia, is that correct? Your first name?
Joe? Josephine, after my Italian grandma, but Joe, yes.
Okay. I love that. Well, I could not agree with you more, and do me a favor. I was at the Armenian home last month, but give your mother a hug and a kiss, and maybe I saw her when I was there. We spoke, myself and the chief of police for city of Fresno. Mm-hmm. We were there for about an hour that morning, but your points are all well taken. And living in Kearney Boulevard in that area, it sounds like we were neighbors. My family, like yours, are immigrants. My grandparents came to this country illiterate, non-English speaking, but a deep desire to work hard and to have a better life for themselves and their families, like your family. And I think that really is part of the secret sauce of America. Immigrants past and immigrants present, all that have contributed, as your family has, World War II and Korea and other efforts to give back to our communities, and like my family has. And that's why I'm fighting for you, Josephine, and for your mom and for your family, because as I told you earlier, my mom used to say, if you don't have health, you don't have anything. Your mom's 102, remarkably, because she's not only got good genes, but she's taken care of herself, and you and your family take care of one another. But if we don't have this safety net for health care for Americans across our country with Medicaid and Medi-Cal and the Affordable Care Act, then that ability to provide the level of health care that you and your mom and your family deserves is going to be very, very dramatically impacted. And so that's why we're having this telephone town hall. And your comments were, I think, right on the mark. And I'm going to continue to fight to ensure that you and your family and families throughout this valley have access to health care. So hopefully, if you have any other questions or something we can deal with, please call my office here and our staff, and we'll move on to the next question.
Thank you, Congressman. And just as a reminder to everyone, if you have a question, you can press *3 on your keypad at any time to get in the queue to ask that question. Next, Congressman, we have a call from a Spanish speaker. The question reads, I have a small business in Visalia. I don't offer insurance, so my employees use Covered California. If these tax credits expire, what happens to us?
Good question. And I hope we have someone who can translate. But, you know, so many of employees and small businesses like yours use Cover California. And if these tax credits expire, it's going to be, I think, really devastating. Half of the adults on the Affordable Care Act marketplace, otherwise called Cover California, are tied to small businesses. Their owners, employees, are self-employed individuals. Treasury data shows 82% of self-employed workers rely on these tax credits. And so if my Republican colleagues block them, we're going to face thousands of dollars of higher in cost, or people are going to be left with losing their coverage altogether. And that means small businesses like yours will lose workers due to illness, and our local economy will take a hit. Kelly, I don't know if you want to opine as well, because Cover California provides much needed insurance for these small businesses.
Yes, thank you, Congressman. I would like to repeat the statistic that you provided, which is nearly half of marketplace enrollees are small business owners or employees of small business owners. The marketplace and the tax credits that are provided through Covered California are really essential to ensuring that these hardworking Californians who have no other source of coverage anywhere else can continue to afford their health insurance. The only thing I also would add is, again, going back to timing. Congressman, you had mentioned at the top of the call about notices that consumers are receiving. Covered California opened the renewal period on October 15th. That means for the 2 million who are enrolled in Covered California, they are receiving those notices. They are getting information about what their costs for health insurance will be next year. What that means is that people are making decisions today. Covered California has been working very hard to try to make sure that all of our enrollees are informed so that they have time to plan and they can understand what their higher costs in 2026 might mean for them if the tax credits are not extended. And we have heard from small business owners and employees of small businesses who are really questioning whether or not they will continue to be able to keep their business going, or do they have to leave their business and find employer-sponsored coverage just so that they can stay insured and have access to health care. And these are very difficult decisions that so many Californians are faced with right now, and the timing really matters. With renewal happening now, with open enrollment around the corner, now is really the time that people are making decisions about their health insurance and their health care for 2026. And to the extent that we can continue talking about extension and creating certainty over extending the tax credits that are available today, that could make all the difference for so many Californians right now who are deciding whether or not to keep their coverage.
You put your finger on it, Kelly. It's my concern as well. Next question.
Yes, thank you, Congressman, and thank you, Kelly. Our next question comes from Mariana Fernandez from Fresno. Mariana, you're live on the call. Feel free to ask your question for the Congressman. Mariana, are you there?
Mariana?
All right, well, we're going to go ahead and go to our next question. Our next question comes from Catherine from Fresno. Catherine, you are live on the air. Feel free to ask your question whenever you're ready, Catherine.
Thank you, Congressman. I appreciate you taking the time to listen to my question. I understand from what I've seen that the biggest roadblock to keep Republicans from allowing the Affordable Care Act to be voted on prior to reopening the government is the ability to stop illegal aliens from receiving the medical and the food stamp programs, or all of the services that all of the citizens, legal immigrants are getting. Is that what you understand to be the big hurdle?
Well, Catherine, I'm glad you raised that issue because it's a falsehood. Some Republicans have claimed that the Democrats, that our efforts to extend the premium tax credits are for the purpose of providing free health care for undocumented immigrants. That is completely false. Let me repeat that. It's false. Undocumented immigrants are not eligible for Medicaid or Medi-Cal, Medicare, or the Children's Health Insurance Program, otherwise known as CHIPS. Federal law has prohibited such coverage for decades, and nothing in the proposed extension of these tax credits for the Affordable Health Care Act would change that. The only exception was when the President Reagan signed into law 40 years ago that says if you're injured in an accident on the road and you end up in the emergency room, that the hospital can get reimbursed for the treatment of the injuries that person received. But there is no effort to provide health care under the Affordable Care Act for undocumented immigrants. They're not eligible. They're not eligible for Medicaid, they're not eligible for Medicare, and they're not eligible for the Children's Health Care Insurance Program. And that is not the reason that we have, are shutting down government. We want assurances from our Republican colleagues that we're going to extend these tax credits for the Affordable Health Care Act so that people will not be panicked here in the next few weeks when they get notices of the increase of their health insurance. And that's the bottom line.
Thank you, Congressman. Our next question comes from Riley from Fresno. Riley, you are live on the air. Feel free to ask your question for the Congressman.
Hello, Congressman. This is Riley. I'm a member with SEIU. Get to meet you and talk to you often. And thank you for your service, first and foremost.
Thank you, Riley.
I was hoping that you can just talk a little bit about the cuts to Medicare that have already happened by the current administration and the Republicans, and the correlation to the Affordable Care Act.
Well, thank you. And I think that's a very good question because the cuts that we're talking about on the Affordable Health Care Act right now are on top of the cuts that the $1.2 trillion that were levied so that we could provide additional tax benefits for the wealthiest people in America. The impacts for long term as a result of these cuts will be over $518 billion, and the state share of that across the country will be over $231 billion. In essence, it's a cut that represents 17% of all national health care spending for Medicaid. And that is going to have tremendous impact. Let me give you some examples. In my congressional district, 66% of the births are covered by Medicaid. And those are very important. As I said earlier, 1.8 million people in the San Joaquin Valley depend upon Medicaid. That's more than the entire state of West Virginia, Riley. I mean, I don't get it. And, you know, a lot of the folks here in the Valley are not only enrolled in Medicaid, but the Children's Health Insurance Program, CHIP, which in my district provides coverage for 60% plus of the children here in my congressional district. And so I think that the impacts, let me give you one other set of statistics, because I talked about our rural hospitals in this country and the meeting I had with in August, a workshop with all the hospitals. The impacts on hospitals and health centers. In my congressional district, Community Regional Medical Center, 55% of their reimbursement, 55% plus, is Medicaid. Cahuilla Hospital down in Visalia, 65% of their reimbursement is Medicaid. Adventist Healthcare in Reedley and in both Fresno, Tulare, and Kings County, 67.7% of their reimbursement is in Medicaid. Valley Children's, I mentioned earlier, it's over 75%, about 76%. And I'm not even getting to our healthcare clinics, you know, whether we're talking about Golden Valley or Clinica La Sierra or United Health Centers. United Health Centers, 61% of their reimbursement is through Medicaid. And so, you know, any way you look at this, community healthcare centers serve 31 million patients in 2023, and 69% of their population was covered by Medicaid. And so that, I think, puts a heavy underline in nursing homes. A lot of our families, we have older members of our family that are getting assisted living. 61% of those folks in nursing homes rely on Medicaid as their primary source of coverage. This is what this is all about, and that's why I'm fighting for you, Riley, and the people of our valley. I'll take the next question. We got a time, I think, for a couple more.
Thank you, Congressman, and you're correct. We have just about 15 more minutes until we are done with this call. And just to remind folks, if you have a question, you can press *3 on your keypad at any time to get connected to one of our staff who can collect your question. I also wanted to say that if you need to seek immediate casework assistance, you can speak to one of our experienced caseworkers by pressing *0 now. That's *0. In addition, if you'd like to be added to Congressman Costa's newsletter as a subscriber, press *6 now. The next person that we'll be bringing on to the call is Leticia Santiago from Fresno. Leticia, you are live on the call.
Hi, thank you, Congressman, for taking my call. I am a widow. My husband passed away in 2024. My daughter passed away in 2023, and I am raising my grandkids. They were in my foster care in the beginning. I am very afraid they're going to lose their benefits, their Medi-Cal, and I do have both of them with asthma. So I'm wondering if that's really going to be the case, if Trump is going to be that mean to take, the health care from the children. And what is he going to do in the ballroom? Dance to the beat of sick kids and starving kids? That is not fair.
Well,
I am very, very...
Leticia, my heart goes out for you, the loss of your husband and your daughter, and what an incredible effort you're making to take care of those children. I'm going to let Kelly address it, but kids in foster care and adopted children will be affected. and foster youth are guaranteed Medi-Cal. And in my district, that's a lifeline, like for your children, your grandchildren, but it's a lifeline for thousands of children. And cuts under the Republican big bill would strip funding for these essential screenings and therapies, mental health, that these children rely on, and it's undermined, of course, by the elimination of the tax credits for the Affordable Care Act protections that let former foster youth keep coverage until the age of 26. And adopted children from foster care also qualify for Medi-Cal. But Kelly, would you like to add to that?
Thank you, Congressman, and thank you so much for sharing your story and your very important question. At Covered California, we have a lot of families who we have parents who are on Covered California, and they have children who are on Medi-Cal. The eligibility for the programs depends on their income, and we are aware whether it is the expiration of the tax credits or the policy changes that are being made to Medicaid or Medi-Cal here in California, that real people are going to be impacted. And I think, we have, I would encourage you to go to our website, coveredca.com, for additional information and resources about how our program may serve. I would also recommend reaching out potentially at the county and your county services, who would have a very strong grasp on what types of programs may be available and how the changes in policy may impact them. Thank you.
I did go to the county yesterday, and the lady said, well, we don't know if you're going to have Medi-Cal next month. That was the answer that I got from the worker there, because government is shut down and might not have Medi-Cal for next month. So that's pretty scary.
No, it is, Letitia, and let's stay in contact. Please call my office tomorrow and ask for Kelly Guild, and we'll continue to try to be there for you and your family, for your grandchildren under these uncertain times, and hopefully we'll get a resolution to the Affordable Care Act tax credits, and to try to figure out how we can fill the gaps in these holes that have been created as a result of this big bill that is devastating our safety net for our health care. And Kelly, I understand you have to depart for other efforts that you're engaged in. Let me just personally say thank you on behalf of my staff for all the good work you do with Cover California. And we'll obviously have to continue to work together as we deal with the challenges that we are being confronted on with the impacts to America's safety net for health care. Thank you, Kelly.
Thank you, Congressman Costa.
Thank you, Kelly, and thank you, Congressman. We have time for one more question this evening, and we have Veronica from Fowler on the line. Veronica, whenever you're ready, feel free to ask your question for the Congressman.
Yes, good evening, Congressman Costa. I'm just wondering, if neither party ever comes to an agreement, how long is this shutdown going to last? Is there an alternative measure? I mean, there's a lot of government employees being impacted, and I get why this is happening, but it's also impacting a lot of government employees.
Well, good question, Veronica. And as I stated earlier on, over 6,000 families in my congressional district are being impacted, and they're expected to work because it's essential services that they provide, but without a paycheck. That's just not right. Let me say that again. We're in the 23rd day of this shutdown, which is the second longest time period. The longest was under the first Trump administration, where the shutdown lasted 35 days. The question that you asked, is there some alternative? There's not. We're going to have to resolve this sooner than later. I did an interview with our local NBC station and said just that this afternoon, because at the end of the day, our primary responsibility as members of Congress, co-equal branches, I might add, although the president doesn't seem to think so on any given day. We, in the Constitution, have the power of the purse. It is our responsibility to pass a budget by October 1 every year. We've missed that deadline. And as a result of that, without a stopgap spending measure, we call it a continuing resolution, government shuts down. That's where we are now. We have come to Washington every week for 4 weeks now, hoping that Speaker Johnson would reconvene the House of Representatives. We are, according to the Speaker, in recess. Recess? Government shut down. We're not supposed to be in recess. We're supposed to be in Washington, sitting down together at the table, working this out. And it ultimately will be worked out, like other important pieces of legislation in our country, through a compromise. But you can't work it out if you're not in Washington. And so I hope next week when we go back that Speaker Johnson will reconvene the House of Representatives so we can work out this compromise for government to be open again, so we will not have this shutdown. People will get their paychecks, and we will extend the operation of government for a time period to allow us to pass the budget in the course of the next month or two. That's what we must do, and I will continue to plead, to urge, and to beg my Republican colleagues to come back to Washington next week so we can reconvene the House of Representatives. And the Senate, as you know, has been in session. The Senate's been attempting to try to work out some level of a compromise between Senate Republicans and Senate Democrats. But the House has been missing in action, and we must get back into session to sit down and to work this out, to open up government again so people can get their paychecks and work on the budget. So I need to close here, but let me just say thank you. We had over 12,866 callers. That's amazing. A large amount of people in my congressional district, 12,866 callers who listened. I think we were able to take 8 or 10 calls of questions. I wish we could have taken more, but we'll continue to make ourselves available through telephone town halls. I'm out in the district all the time, whether it be in the rural areas of Fresno and Tulare County, or because I think it's important that I be accessible to all of the constituents and be there for you along with my staff to help out on problems that you and your families may have. So once again, thank you all. Thanks my staff and for making this telephone town hall. And I'll let Grant close here, who's done such a good job moderating this telephone town hall. Thank you.
Thank you so much, Congressman. And as we're coming to a close for this important Fighting for Affordable Care telephone town hall, we appreciate the opportunity to speak directly with you and to answer your questions. If we were not able to get to your question answered this evening, you can leave a voicemail after the event, send us an email via our website at costa.house.gov, or call our Fresno office at 559-495-1620. Again, that's 559-495-1620. We will host more of these events in the future to keep you informed on what we are working on and other important updates. If we were not able to get to your question this evening, you can leave a voicemail after the event or press *6 to give your opinion or leave a comment. Thank you again, and have a good rest of your evening.